Well, welcome. Thank you for joining us for this webinar on promoting mental health and well-being in schools, an action guide for school and district leaders. My name is Jean O'Connor. I'm the project director for the Medicaid School-Based Services Technical Assistance Center. Delighted to be here with you today. We have a wonderful speaker from CDC, as well as a practitioner from the field joining us today. So we'll go ahead and get started. I will talk through our objectives in just a minute. We will also review the Bipartisan Safer Communities Act, introduce and discuss CDC's Mental Health Action Guide. We'll have a brief panel discussion, questions, and conclusion. You will be welcome to place your questions in the Q&A as we get started. So thank you again for being here. By the end of this webinar, we hope that you will be able to recognize the importance of addressing mental health within schools, identify strategies for promoting mental health and well-being in schools, describe additional considerations for implementing approaches that promote mental health in schools, and locate tools and resources to support mental health promotion and strategies in schools. As many of you know already, on June 25th, 2022, President Biden signed into law the Bipartisan Safer Communities Act. This act directs the development of the Technical Assistance Center through collaboration between the U.S. Department of Health and Human Services with the Department of Education to focus on the activities you see listed here on the slide. Specifically, the law requires HHS and the Department of Education to issue guidance to state Medicaid agencies, local education agencies, school-based entities to support the delivery of medical assistance to Medicaid and CHIP beneficiaries in school settings. At the same time, CMS and ED were asked to establish this technical assistance center that's designed to assist states, state Medicaid agencies, school districts, state Department of Education, to provide assistance under Medicaid. The task of the Technical Assistance Center is to reduce administrative burden and support school district and school-based services for obtaining payment for Medicaid reimbursement and to ensure ongoing coordination between school districts regarding the provision and payment of Medicaid services. For Medicaid, SBS, the Bipartisan Safer Communities Act specifically addresses establishing responsibility for interagency coordination between state agencies, providing state Medicaid agencies and state education agencies with technical assistance that is necessary for them to provide school-based services. A special rule that identifies the requirements that may be met through state statute or regulation, signed agreements or other appropriate written methods. And for school-based services, there is a specific responsibility for interagency coordination at the state level. And we want to use this opportunity, like our other webinars, to provide state Medicaid and education agencies with the technical assistance needed for them to access Medicaid to provide school-based services. We're especially excited that today, May 9th, is National Children's Mental Health Awareness Day, and we are grateful to have our partners at CDC here to discuss strategies and approaches that schools can take to support youth mental health. So I am very excited to welcome Dr. Kathleen Ethier, Director at the Centers for Disease Control and Prevention, Division of Adolescent and School Health, to present us with some information from CDC today. So Kathleen, welcome.
Thank you so much. I'm so happy and excited to be here. As Jean said, my name is Kathleen Ethier. I'm the director of CDC's Division of Adolescent and School Health. We are the kind of place at CDC where all of the school-based work sits. And as you can imagine, for the last number of years, we've been really intensely concerned about young people's mental health. So today I'm going to talk to you a little bit very broadly about the work that we do, and then very specifically about a resource guide that we put together to help schools kind of take a look at the current set of practices that they have in place to support mental health and well-being in their schools, and then to think through what additional strategies that they might be able to add. And so I'm going to just start for just a minute to talk a little bit about what the Division of Adolescent and School Health at CDC does. So Our vision for from a public health perspective is a future where all young people in the US are empowered with knowledge and skills and resources to support their health and well-being. And that includes kind of a very specific focus on particular behaviors like substance use, sexual risk behavior, experience of violence, physical activity, and nutrition, all of which schools can address, but then also really broadly their mental health and well-being. And so we do that primarily through a program called What Works in Schools. We fund local school districts to implement an evidence-based primary prevention approach that promotes protective factors for adolescents by implementing kind of three key things that we know schools can do really well: improving health education, connecting young people to the services that they need, and making school environments safer, more supportive, so that young people feel connected and engaged. And as we talk about the resource action guide, you'll see that many of the strategies that we're talking about kind of fall into one of those key strategies. By implementing these three strategies, schools can improve students' mental health, reduce substance use, reduce sexual risk behavior, and experiences of violence. And as we've been seeing the mental health of young people decline, as I said, we've been really increasing our focus on mental health in all of the work that we do. So this is some of the data that we've used. Perhaps many of you are familiar with the Youth Risk Behavior Survey. That's a survey that is run out of my division. And we monitor health risks across a wide variety of outcomes. But what we had started seeing even prior to the pandemic was that indicators of adolescent mental health had been moving in the direction for more than the wrong direction for more than a decade. So for instance, in 2010, more than 4 in 10 high school students felt so persistently sad and hopeless for at least 2 weeks in the year prior that they had been able to engage in their regular activities. Almost 30% said that their mental health was poor in the last month. 22% had seriously considered attempting suicide in the past year. And 10% in the past year had attempted suicide. We know from our data that in particular, female students and LGBTQ students were very disparate in their experience of poor mental health and suicidal thoughts and behaviors. And here is some of that data. So what we see on the right-hand side, female students were more likely to experience depressive symptoms, attempt suicide. LGBTQ plus students were, again, also more likely to experience depressive symptoms and attempt suicide. Black students were also significantly more likely to attempt suicide in the year prior to the data. So what we know is that not only are students experiencing poor mental health, but particular groups of students are at much higher risk. And so as all of you know, because you're here and this is part of the work that you do, schools are really an ideal venue to promote behavioral and mental health because for a couple of reasons. One, we know from the work that we're doing with schools, we hear from them all of the time that mental and behavioral health is a huge issue for them. And so they're grappling with the mental health and behavioral health issues in their students all day, every day. But also we know from public health that if we want to address the health of an entire population, we need to go where they are. And since schools reach 95% of youth for most of the day and most of the year, school-based strategies really have the potential to improve broadly the mental health and well-being of all young people. And I know that many of you are here because you are in a position to decide on particular services that would be available to students in school. We also thought you'd be a really ideal audience to talk about upstream prevention strategies, which is really what CDC does and what we've been doing in schools for a very long time. And so while behavioral and mental health services are essential for young people who need them, we know that meeting the current need is a challenge. And so by taking an upstream approach and providing education and early intervention strategies designed to reach large numbers of students, schools really can promote positive and behavioral and mental health and help reduce the need for services. To support upstream prevention in schools, we released the Promoting Mental Health and Well-Being in Schools Action Guide. This action guide describes 6 in-school strategies and supporting approaches that have been proven through the literature to promote and support mental health and well-being. And it can help schools build on what they're already doing to promote students' mental health and find new strategies to fill in gaps. Now, the strategies and approaches that are contained in the action guide were identified using a combination of methods, including peer review of the literature, gray literature review, and then we did extensive expert listening sessions with folks just like you, and focus groups with parents and students in order to really understand what is going to work in schools. What do you most need to be able to both make decisions about strategies to implement in your schools, but also some understanding of how that would go. So we gathered a great deal of contextual evidence, as I said, looking through kind of gray literature, but also really wanting to understand the context for how those decisions about what was being implemented in schools were made. And so once we had all of that in place, we then worked with subject matter experts from school districts, universities, government agencies, and nonprofit organizations to provide feedback on what we had compiled through the action guide development process, so that we would really have insight into whether or not this was going to be usable. So this process, which took several years, resulted in 6 proven strategies and supporting approaches that schools can use to promote students' mental health. To help make it more actionable and useful for schools, each strategy includes implementation tips, principles for focusing on equity while implementing the strategy, and links to additional resources that can support the strategy. Each approach also includes the specific mental health outcomes that strategy has been demonstrated to affect, including outcomes with impacts on potentially diagnosable mental health conditions, but also broad mental health outcomes like stress, as well as assets like positive coping strategies. Each approach also provides example programs, policies, or practices to demonstrate how it can be put into action in schools. We also realized that since many districts use the multi-tiered systems of support, that it would be beneficial for anyone who is making decisions about which strategies to adapt to identify where the individual strategy that we were recommending fell. So to take a population level approach and use a familiar model, we primarily focused on tier 1 and tier 2 strategies. And so that these strategies and approaches can enhance the support that schools have already established. The 6 strategies included in the guide are increasing students' mental health literacy, promoting mindfulness, promoting social, emotional, and behavioral learning, enhancing connectedness, providing psychosocial skills training and cognitive behavioral interventions, and supporting school staff well-being. I'm going to summarize each strategy and approach and provide some examples of how the approaches can be delivered and outcomes that they impact. And where appropriate, I'll also point out additional resources that we have to support that approach. So schools can increase students' mental health literacy by delivering classroom-based mental health education curricula and implementing peer-led modeling programs. Schools can teach about mental health in core classes or include mental health in health education. And we know that teaching about mental health can reduce stigma and improve students' knowledge and attitudes about mental health. We have in place our Health Education Curriculum Analysis Tool, or HECAT. The link is there at the bottom of the page, and that really can help schools select or develop quality health education curriculum that support mental and behavioral health across all grade levels. Schools can promote mindfulness by delivering classroom-based mindfulness education, dedicating time for students to independently practice mindfulness, and offering small group mindfulness activities. Practicing mindfulness can help students manage everyday stress and emotions and help them be more in control of their feelings and actions. All of these approaches can decrease anxiety, and classroom-based mindfulness education and giving students time to practice mindfulness on their own can also increase assets like resilience and positive coping behaviors. Schools can promote social, emotional, and behavioral learning by providing classroom instruction focused on building social skills and emotional development, offering targeted education focused on teaching social skills and emotional development. Social and emotional and behavioral learning focuses on really 5 key areas: self-management, responsible decision-making, relationship skills, social awareness, and self-awareness. And those can really be provided on a universal level that reaches all students in a grade or a classroom, but also more targeted on a more targeted basis that helps students who have kind of need additional support to develop those skills. Among other outcomes, both targeted and more universal programs can decrease symptoms of depression and feelings of anxiety. So we know that connectedness underlies so much of the support that schools provide. School connectedness, which are feelings that students have that people at their in school care about them, care about their success, care about their well-being, has long-term impact on the health and well-being of students. We know from research that we've done at CDC that young people who feel more connected to others at school not only do better during their school years, but up to 20 years later across a wide variety of outcomes, including mental health, suicidality, and experience of violence and substance use do better. So young people who feel more connected during their school years do better 20 years later across those outcomes. And so at CDC, we have focused a great deal of our work on school connectedness. We've provided a link here to the ways in which we address school connectedness. And for the schools that we work with, focusing on classroom management, so providing professional development on classroom management techniques and policies and practices, using youth development approaches, including service learning programs and mentoring programs. So getting young people out into their communities to provide service and bringing important community members into schools to provide mentoring, and a focus on LGBTQ supportive policies and practices have all been demonstrated through the work that we've been doing, particularly through our What Works in Schools program, to improve school connectedness. Psychosocial skills training and cognitive behavioral interventions engage students in coping skills training groups and promote acceptance and commitment to change. They teach students specific skills to help them cope with challenging situations, set goals, understand their thoughts, and change behaviors using problem-solving strategies. When these programs are put in place, we can see decreases in depression, anxiety, and an improvement in students' coping skills. We heard almost universally throughout the process of engaging with experts, both in school districts and outside of school districts, as well as through the program, our own programmatic work, that it is impossible for teachers and school staff to support the mental health and well-being of students if we're not attending to the well-being and mental health of those teachers and school staff. And so although the literature kind of is less robust in this area, we know that it is incredibly important for districts to really attend to the mental health and well-being of staff. A couple of the strategies that have been shown in the literature to work are to offer mindfulness-based training programs and to provide access to therapeutic resources. We would love to hear more about strategies that districts are using to support the mental health of their staff. And I think this is an emerging area that is going to be incredibly important moving forward. So in addition to the strategies and approaches included in the guide, there are also some strategies that repeatedly came up in our focus groups and listening sessions where, kind of similar to the issue of staff well-being, may not have as robust a literature at this point because they're emerging, but we heard over and over and over again as being important to promote nurturing and to promote positive mental health. So we provide some information about those in the guide. Those include restorative practices, information on gender and sexuality alliances, and other types of practices that may not be included in the guide, but that we can provide on our website and the supporting resources that we have available. I think, having seen the array of partners who join these webinars, we know that you probably all play slightly different roles in the implementation or the support of mental health services and mental health programs in school districts. So I wanted to just kind of suggest additional considerations to keep in mind for the implementation of any of these strategies. So it's incredibly important, we heard this throughout the process of the development of the guide, to effectively and equitably promote mental health and well-being for students, to consider the diverse needs that students may have. The activities that you see here are described in more detail in the guide, and they can range from incorporating culturally and linguistically responsive information into mental health programming to really reviewing school policies and practices. For instance, any anti-bullying, anti-harassment policies that you have in place, and considering how they may negatively affect student mental well-being. And lastly, comprehensive assessment tools can serve many purposes to understand and address student needs. You may already have an assessment tool that you're using in your school, but there may be areas where assessment data can be used to help understand how staff and students are implementing new programs, policies, or practices, and assessing how implementation is affecting mental health and well-being, to inform decisions about supports that students need, or to help link students to needed services. There are a range of assessment tools that can be used across these different purposes, and we provide a few examples of specific tools in the guide, but you may know areas that could be strengthened in your own school and tools that may meet those needs. So thank you again for being here today and for the work that you do, which is so essential in moving us forward to support the mental health and well-being of students. I really invite you to learn more about implementing the strategies and approaches that we provide in our action guide, and we provide the links for you. When you get to our website, the PDF provides really detailed information, and the website is really a distilled version of the PDF that's really designed for busy leaders like you. Just wanted to mention a couple of tools that we've developed to support implementation. The first provides practical tools designed to help schools reflect on what the school district is already doing to promote mental health and well-being, to prioritize strategies and approaches from the action guide to fill gaps and strengthen what's already in place, and plan for action to implement the strategies and approaches. The second is a presentation template that can be used to help school and district leaders communicate to key partners, for instance, school staff, district administrators, school boards, parent groups, about their plans for implementing strategies and approaches from the action guide. We also have a variety of resources on our website that can be used to support a whole array of activities in schools. So I mentioned our HECAT, which is our Health Education Curriculum Analysis tool, that not just for the strategies designed here, but for any health education needs, you can use this guide to help you either assess or develop health education curriculum. We also have a self-assessment tool for schools that want to improve the LGBTQ inclusivity of their schools. And then we have a wide variety of data resources available on our website. This is our data summary and trend report, which contains some of the data available in the YRBS. This will be updated in probably around August with the 2023 data. So keep an eye out for that. And although we know that not all schools will be able to use all of the strategies in the guide, we really think that there's something in there for everyone. Schools can pick and choose strategies and approaches based on their existing capacity, and what they're already doing to improve mental health. So really wanted to thank CMS and the TA Center for having us here today. Happy to answer questions as part of our panel. And please feel free to reach out to us if there's anything on our website. If you'd like more information on anything, there's ways to contact us and we would love to hear from you. So thank you so much.
Thank you so much, Kathleen, for that presentation with really great information in it. I'd like to invite Jeff Ginzer to join us. Jeff is a licensed clinical social worker who spent the past 20 years working with adolescents and families in a variety of settings in towns and communities, including with schools, in and surrounding Boston and the Hartford, Connecticut area. We are delighted to have Jeff here as a discussant as we go through some questions, and we'd like to invite you as well to post your questions in the Q&A, and we'll get to as many of them as possible. Jeff, do you want to take a moment to just briefly introduce yourself?
Sure. Hello, everybody. First, I really want to say that I feel tremendously honored to be here with all of you and playing even a small part in this important initiative. I don't know any of you really, but I can pretty much assume that we're all in this for a similar reason. That's to help kids feel better about themselves in an unpredictable world. I've been working as a solo practitioner in the Farmington community of Connecticut for about 24 years. Haven't updated my my bio yet, but you know, I've gotten an opportunity with my partner to watch the landscape of mental health change among kids and families over that period of time, and seen some pretty significant difficulties, you know, really increase among kids and families. And this initiative is incredible, and we all have an opportunity to make some important changes that I think are going to affect generations. So again, thank you for having me.
Thanks, Jeff, for joining us. We've got a couple of questions for you, and we'll also start taking some questions from the audience here. First, I'd like to ask Dr. Ethier a question and follow up to her presentation. So you mentioned 6 strategies for promoting mental health and well-being in schools. If you had to name one thing, one key thing that schools and mental health professionals could do to improve mental health out of those 6 and the many things you mentioned on the call today, what would that be?
So I think universally the thing that we know has probably the most long-term positive impact is connectedness. So much of what I think young people are experiencing, have been experiencing for a while, but what really got exacerbated during the pandemic was that sense of social isolation. We know that social isolation underlies not just mental health, but other outcomes as well, like experience of violence and substance use in particular. And so, and I think as adults, excuse me, we know that as well, right? We know how our lives were impacted by the isolation that we experienced during the pandemic. We knew that already. We knew that connectedness was really key, and that disconnection was a definite risk for young people. I think we really got to see that. And so we also know some very key ways that schools can improve students' feelings of connectedness. We've been doing that work for a really long time. So I would say these are things that all schools can do and can be built really very much into what every teacher does, what every administrator does, what every counselor does, what every coach does. and what every sponsor of a club at a school does, right? Like this is something that can really be built into everything that schools do. And so I would say go there first. I would say work on improving connectedness first.
Yeah, thanks so much. That's such an interesting answer. Jeff, I'm really interested to get your perspective as a community mental health provider who works with kids in schools, both about that idea of connectedness, but also sort of what does it look like when there's a successful partnership between mental health providers and groups promoting positive mental health in schools?
Sure. I want to agree with Kathleen. I really hammer home the point that social isolation is one of the biggest problems I see every day in my office, whether it's an adult or a child. And I've yet to see a mental health disorder or a clinical presentation of depression without an impact on social life. And the more a person retreats into themselves, the harder it is for them to be with others. And, we're social creatures by nature. We need that connection. And when we get it, we feel validated. So yes, anything we can do to bring people together is incredibly important, especially in the schools where people are physically together, but often feeling really far apart. To answer your question, Jean, in terms of what successful connections look like, I think this comes down to, the word partnership really sort of screams true here. And I think, as a community-based provider, I think this really comes down to good and thorough clinical practice. I think, we need to make ourselves very visible to the schools. And my partner and I, Dan Weiner, who couldn't be here with us today, do so by showing up to PPT meetings, communicating with guidance counselors and teachers on behalf of the children and adolescents that we work with. We try to offer the schools small fee or pro bono assemblies that that bring parents together, sometimes with the kids, to talk about the most salient mental health challenges that exist today. People are hungry for information, and when we don't talk about it, we're sending a message to people that it's less important. And I think mental health has been in that position for a long time. We do our best as providers to educate people about, depression, anxiety, ADHD, and autism, and what these look like, and how teachers who are on the front lines can play an incredibly important role in identifying. Sometimes they are the first person to identify these challenges. I also think flexibility on the part of community providers is essential. It's helped us as a practice to make sure some of our time each week is actually put aside to reach out to teachers to support the work that they're doing with students on a daily basis. And, and I'm a big believer that teachers are superheroes, and they're asked to do many things in the spirit of raising our children and spread themselves incredibly thin. So I think we as providers outside of the schools can do our part in making ourselves available to these kids and families when needed.
Thanks, Jeff. That's such a great set of examples, and appreciate really that you and the colleagues in your practice are really modeling those kinds of great partnerships with schools. It's really interesting to hear about. And I think when you said people are really hungry for information, that really resonated with me. I want to ask another question because we've got some coming in the chat around kind of the translation of in-school strategies where Kathleen said, kids spend the majority of their time. Many kids spend more than half of the waking hours, right, in their day, maybe 2/3, right, in and around school-based settings. So schools can be a really effective way to reach them. But I'm kind of thinking about this question about translation of the school strategies and the things that Kathleen described to the community setting. And so, Jeff, I'm wondering if you have any thoughts, or Kathleen, you as well, for sort of how can we create a cohesive environment for youth where the strategies being used in schools are also being used at home and in the community and vice versa.
Well, let me go ahead, Jeff. Sorry.
Go ahead. Yeah, I'll follow you.
Well, I was going to say, we've focused primarily on school connectedness because that is and there are specific strategies that schools can put in place. But the literature shows that connectedness within communities, and also really importantly, connectedness in families, has the same important benefit, both kind of in terms of during those school years, during young people's early life, and then into adulthood. So I think anything we can do to support families in staying connected to each other, I think is incredibly important. And then also providing community-based places for young people to be connected to each other and to important adults is really important. We want young people's time out in their community spaces to be safe and to be supported. In the same way that we want that to happen in schools, we also want communities to be that way. It's harder sometimes. There's not the structure that's there. And so providing opportunities for young people to be engaged in a safe way that keeps them occupied and engaged in kind of pro-social activities is really important. It's a little bit why we focus on why we focus on service learning programs, which is really about getting young people out into their communities and engaging in really positive activities. But that can also be team sports. That can also be youth centers. That there's like a whole variety of ways in which we can engage young people in their communities that really will have that similar impact. It doesn't have to be in school. We just focus there because that's kind of a place we can reach all kids.
Yeah, and I think that, Kathleen, along the lines of connectivity and engaging the community, I think first off, it's incredibly important because problems in one setting definitely impact problems, the other setting. Yeah. And when there's no communication, when they're not working together, that means this child is really floundering across environments, and that's a pretty significant problem for these kids and families. I will often say to parents, that when they ask about how much they need to be involved in the process, I'll say, well, there's nothing that I can do in 45 minutes that you can't undo in, 30 seconds if we're not working together. And, and setting up that expectation of partnership is really important. And I know in the school systems, this is one of the oldest problems, trying to pull family members in support of the kids. And I imagine, for those that are working in the schools now is even harder, with, some of the economic pressures on families and some of the major mental health issues that have bubbled to surface since the pandemic, and increased isolation of people. We really try to encourage more interaction between kids and families. As I was thinking about this, question, right, you're answering it, I was thinking about, well, what are some creative interventions that can exist? Maybe that involves sending worksheets home with kids, that address mental health and whatever the curriculum is that they're working on, that they can sit down with their parents and work on together, and can, kind of activate discussion among them. we can also be more conscious about, bringing together really important and meaningful partnerships between community agencies that serve kids. I've seen it done really well in Boston, where Boys and Girls Clubs are included in the process of the wellness of the kids, and there are meetings on a regular basis that include club staff members, parents, kids. There are concerned teachers that will come in at times, and when that collaboration can happen, we can wrap around these kids in ways that are incredibly supportive.
I think
So yeah.
No, I think one of the things that brings to mind, mental health literacy is something that we know improves our understanding of our emotions, our understanding of our feelings, our understanding of our behaviors, and it helps decrease stigma associated with mental health, and it also allows us to know when we need to ask for help. And we focused a lot on, helping children and adolescents gain mental health literacy. And I don't know whether we've done the same with families more broadly. And so the kids are learning about kind of what's going on in their hearts and in their heads and what that means and when to ask for help. We probably need to help them do that same thing with their families. There's still a great deal of stigma in many communities around mental health, around getting mental health support and care. I think that is changing over time, but maybe not as quickly among the broader population as it's happening with kids. And so as we do that, as we teach kids to kind of understand their emotions and understand how to manage them better, we probably also need to do the same thing with their families. And so, Jeff, exactly what you're saying about, I don't know if it's a worksheet or whether it's something that we provide for families and caregivers, but I think we need to make sure that as we're teaching young people at making them more literate about their mental health and about asking for help, that we are also doing that with their families.
Yeah.
I love this conversation. I think this is so interesting and really important. One thing that comes to mind is a question I had about equity. And so when we're talking about this, right, mental health cuts across the entire spectrum, right, of our population. And mental health challenges are not isolated necessarily to a particular group, right, or a particular place. But equity in this is a real consideration. And I'm really curious, as we talk about this, there are children who are most in need, right, of access to mental health services, of some of the strategies that Kathleen, you described, Jeff, the work that you do, who are probably the least likely to get those things because there's in a school or in a community where resources are really limited. They may have a family that is challenged, right? The parents don't have those skills as you were just talking about. And so they're not able to apply those or transfer those, right, at home with the child. Do you have any thoughts about how we reach those youth or those schools or communities that are really most in need, who have the most limited resources? Because schools are being asked, right, to do so many things. I want to just acknowledge that. We don't want this to feel like one more thing. And the ones that need the help the most may be the most overwhelmed as well. So I'm curious if you have any thoughts there.
So we see disparities show up in the data in a variety of ways that don't necessarily map on in kind of the traditional way that we think about disparities. And so that in any given community, the young people who are actually doing the worst are girls and LGBTQ youth. And there are strategies, those disparities are dramatic. And we're trying to we understand some of why that happens, and that is, due to experience of violence. Girls are more likely to experience violence than particularly sexual violence. There is kind of stigma and harassment. So LGBTQ students are more likely to experience stigma and harassment. So things that kind of directly affect their mental health. So there are those issues, there are then strategies that you would specifically kind of put in place to address those young people. Interestingly, that we find that when schools put LGBTQ inclusivity practices in place, not only does the mental health of those students improve, but the mental health of students who identify as straight also improves. So something about changing the school environment for those most vulnerable youth improves the mental health of all youth in a school. And I think that's really significant. But I think, Jean, to your kind of separately, while we don't see differences, when we've looked at differences by poverty level of schools, we don't necessarily see the same kinds of disparities in mental health and suicidal thoughts and behaviors. But you're exactly right in the sense that we may end up, as we've layered more and more resources into supporting mental and behavioral health, we may start to see disparities where we didn't before, because there are schools that are more that just are more burdened and have fewer resources, have less access to counselors, and so may not be able to kind of get themselves out of where we are with mental health with young people in an equitable way. And so I think for that reason, we really do need to make sure that we're making a wide variety of strategies available, and in ways that don't require heavy duty financial and personnel resources. I think those having that whole array of ways in which schools can work on this issue is really important. The other thing I do also just want to say is that, we focus on mental health in terms of looking at kind of symptomatology and suicidal thoughts and behaviors. But I think we need to do more to understand how behavior that we would slate for discipline is actually a sign of mental health issues. And I think that's definitely the case for boys, and may be the case for some other groups that we're kind of counting as behavioral issues that require discipline, but are really about mental health. And so I'll stop there. Sorry, Jeff.
Oh, no. So, this was bringing to mind, actually, I thought I was just recently talking with one of our staff members who her day job is a school social worker, actually a school psychologist in a community not too far from here. And she was telling me she's responsible for holding PPTs and doing student evaluations and reevals. And any of you, I'm sure we may have some school psychologists out there in the audience, but we recognize how incredibly difficult your job is, that as the needs increase among students and among communities, that doesn't necessarily mean that you're given reinforcements to do your work the way you need to. This therapist that I was talking to said, this month, 25%, she got this figure of 25% of the student population in her school has an active IEP, an active independent education plan. That means a quarter of her school is struggling with either profound academic difficulties, learning difficulties, or mental health problems. And those are just the ones that are identified. So we're clearly in a crisis, and what this calls on is not necessarily like, bolstering the mental health team in every school. That would be nice, but we can work toward that. But in the meantime, strengthening the resources that already exist in these communities. whether they be religious institutions of churches and synagogues, or reaching out to the Boys and Girls Clubs, or community support officers and providers that can donate some of their time, because we want to respect the cultures that exist in any given community. And what really needs to happen is we need to help the staff that currently exists in these schools with understanding how to approach these kids, how to identify the problems that exist. And, if we focus too much on money, as we do in a variety of ways, we're going to continue to struggle with this in ways without reaching the kids and giving them what they need. But there are many incredible adults in these communities that can, if given the resources and some education around assessment, can really help these kids and bring out important conversations so that they can feel like they're being heard, and somebody can recognize these early warning signs before they turn disastrous.
Yeah, Jeff, thank you so much for that reminder. I think it's a really great reminder because, of course, part of why we're here is that there is this mandate, an opportunity to provide technical assistance, right, for state Medicaid agencies and state education agencies to expand Medicaid, which is one way of financing, right, access to services. But I really appreciate your point that we also have to think about the kids first and the needs and opportunities in schools first. And Kathleen, I think I heard you say that too, that even if you can't get all the way to implementing all of these strategies, that there are some things that really any school system or community could be doing. I think that's really helpful. We've got a question in the chat that I want to turn to, which is that we did have a question here about whether there are model sort of policies, or the question says state level policy determines how education and mental health services are available. And they're asking, what are some model policies for providing equitable access? Does anything come to mind, Kathleen, in particular for you? I'm wondering, or Jeff, any kind of community examples?
So I think in terms of when I read the question, it was very much about providing services. And I think so what we really focus on is kind of these universal programs and policies to to address issues in the school environment, as opposed to really specifics around providing services. So I'm not sure that I have the answer to that question around model policies for services at the state level. So someone from who's on for CMS might want to answer that question. Oh, Kate just popped on.
You say mental health services being provided.
And here you are.
And here I am, on Kids Mental Health Awareness and Acceptance Day. So what I would say is that because of the way that Medicaid works for kids, and Medicaid covers about half the kids in the country, because of the way that Medicaid works, there's actually the ability for state Medicaid programs to cover a really broad array of services, including, and I mentioned this in the Q&A, including preventive services for kids. And what we see is in states where there is a broad array of services, we hear less about access issues, and sort of we hear about a lot of coordination between schools and community-based providers. So there's a lot of flexibility for states, including thinking about who's a provider, because we know in some, Jeff, you're sitting in Connecticut and I'm sitting in Massachusetts, and we have more than our fair share in terms of density of providers, and that's not the case across the country. But there are a lot of state Medicaid programs that are thinking creatively about who can be a provider and what the sort of provider ecosystem looks like in order to really reach kids and their families, both inside of schools and outside of schools. And one last thing that I would say, which is As we have been talking so much about school-based services, we've been hearing about the importance of the coordination between the health plans, the Medicaid agency, the schools, and the community providers. And that is really critical for kids and their families, whether they're kids who are on IEPs or not on IEPs, whether they're sort of regardless of what else may be going on. If there are a lot of adults working with kids and with their families, it is incumbent upon the adults to figure out how to work together so that kids are getting what they need and not having redundant services, or not having gaps where they have two of this and none of that, right? So that's the other thing that we've been thinking a lot about and are sort of encouraging of the in terms of the implementation, both of school-based services and community-based mental and other behavioral health services.
And Kate, I think, we've had a lot of conversations about kind of how our collaboration with the kind of work that we are promoting in schools and the work that CMS is doing with schools can support each other. I know in the guide, the strategies that kind of live at the tier 2 and tier 3 level, which are not the bulk of the strategies, but certainly are there and are available, and implementation suggestions and all the kind of supporting documentation are there, are the most ripe for reimbursement. They are the things that schools can most likely get reimbursed for. So if that's an issue, we might want to advise you to focus on those strategies as ways in which we can have that collaboration. And then at the same time, the tier 1, those are things that are very easily implemented across an entire school. And so I think it's a matter of also determining from a school-based perspective, what do you need? If you already have services and systems in place that are well reimbursed, you might want to focus on the more universal ones. If what you're missing is some of those tier 1, tier 2, and tier 3 strategies, then that would be a place to focus. And so I think it's really a matter of kind of understanding what your district and what your school needs, and then adding in additional strategies as appropriate.
I'm just going to add one. I think Kathleen and I could talk about this all day, probably. I'm going to add, in the interest of time, I'm going to try to be quick. But one of the flexibilities that we put out in the guide was the fact that actually school providers, the state can define school providers in a different way than community-based providers. It gives some flexibility for school psychologists, school social workers, and other school behavioral health providers to be included in the Medicaid reimbursement if the state allows for it. And so I think when you're thinking about those tier 1 or even sort of lower tier 2, I'll call them services, and wanting to get reimbursed for those, if the folks who are doing them can become providers and therefore participate in the RMTS, sorry, I'm speaking Medicaid, the random moment time study, that can increase the funding to go towards those tier 1 and lower tier 2 services as well. So we're sort of trying to put all the pieces together.
And we're right, unfortunately, at the top of the hour. So I want to thank our panelists, Kathleen and Jeff and Kate. Thank you for jumping in here. I think we could talk about this all day, including more about the partnership between community mental health providers and schools, as well as Medicaid policy on funding. We will follow up with answers to questions that we did not receive, we were not able to address on today's webinar. Really appreciate everyone being here. And if there is interest, we'll make sure to try to offer a part 2 of this conversation in the coming year. So thank you all so much for joining us. And we will post the slides and the recording of this webinar on the TAC website. Thank you, everyone.